The aScope 4 Broncho is a high-quality, single-use flexible bronchoscope. It's sterile and easy to use right out of the package. The aScope comes in 3 sizes: slim, regular, and large. The aScope has a 60 cm long insertion cord with a distal tip, which houses 2 LED lights and a CMOS camera. There's a built-in endotracheal tube connection to keep the tube secure and out of the way until it is needed. The handle of the aScope has a suction connector, suction button, and working channel port, which allows for the installation of fluids and insertion of endoscopic accessories. The aScope comes with a luer lock introducer, which fits into the working channel port to facilitate introduction of luer lock syringes and endoscopic accessories. To use the introducer, insert it into the working channel port and push firmly. Before using the aScope, first visually inspect in the pouch to make sure the seal is intact. Open the pouch carefully and remove protective elements from the handle and insertion cord. Check to make sure there are no rough surfaces or sharp edges which may cause harm to the patient. Connect the aScope to the aView by plugging the white male connector with a blue arrow into the corresponding blue female connector on the aView. Press the power button on the top of the aView once. Verify that a live video image appears on the screen by focusing the distal end of the aScope towards an object. Carefully slide the control lever forward to confirm that the bending section functions smoothly and correctly. Verify, if required, that endoscopic accessories of appropriate size can be passed through the working channel without resistance. The aScope can be used to assist in intubation. To begin, lubricate the insertion cord to the gray line mark using a medical-grade lubricant. Make sure not to get any on the tip or camera. Mount an endotracheal tube. To insert, hold the handle of the aScope in either hand and use the hand not holding the aScope to advance the insertion cord into the patient's mouth or nose. When inserting the aScope orally, it is recommended to use an oral airway to protect the aScope from being damaged. Keep the device vertical with the working channel port pointing straight up. Use a thumb to move the control lever and an index finger to operate the suction button. The control lever is used to flex and extend the tip of the aScope in the vertical plane. Moving the control lever downward will make the tip bend anteriorly, and moving it upward will make the tip bend posteriorly. Rotating the handle controls left and right movement. If the camera image becomes unclear, the tip can be cleaned by gently rubbing it against the mucosal wall. Once the tracheal rings are visualized with the aScope, detach the ET tube from the tube connection and advance along the insertion cord into the airway. Fluids can be instilled through the working channel by inserting a syringe into the working channel port at the top of the aScope. When using a luer lock syringe, use the included introducer. Insert the syringe completely into the working channel port or introducer and use the syringe to instill fluid. To expel the fluid left in the channel, flush with 3 to 4 milliliters of air. If a suction system is connected, suction can be applied by pressing the suction button with the index finger. Make sure not to apply suction during the installation process, as this will direct the instilled fluids into the suction collection system. When working with endoscopic accessories, make sure to select the correct size accessory for the aScope. Inspect the accessory before using it. If there are any irregularities in operation or appearance, replace it. Insert the accessory into the working channel port and advance it carefully through the working channel until it can be seen on the aView monitor. The aScope 4 Broncho Slim can be used to assist in placement of double lumen tubes 35 French and up, as well as the placement of bronchial blockers in single lumen tubes 7.5 mm and larger. To use the aScope to assist in double lumen tube placement, connect the aScope 4 Slim to the monitor, lubricate, and select the appropriate size DLT for the procedure. Using a laryngoscope to visualize the vocal cords, insert the double lumen tube following a standard procedure. Once the tip and bronchial cuff have passed through the vocal cords, use the aScope to position the double lumen tube in the normal manner. Once the position of the bronchial cuff is confirmed, inflate both the tracheal and bronchial cuffs and remove the aScope. To use the aScope to assist in bronchial blocker placement, connect the aScope 4 Slim to the monitor, again aligning the blue arrows. Attach the multi-port adapter of the bronchial blocker to the indwelling ETT and insert the aScope 4 Slim into the bronchoscopy port. Use the aScope to visualize placement of the blocker in the desired bronchus. Inflate the bronchial blocker balloon, confirming proper position with the aScope. Remove the aScope. Once removed, disconnect the aScope from the aView. The aScope is a single-use device and must be disposed of in accordance with local guidelines for collection of infected medical devices with electronic components. Do not soak, rinse, or sterilize this device, as these procedures may leave harmful residues or cause malfunction of the device. The design and material used are not compatible with conventional cleaning and sterilization procedures.